And I know that, the American Association of Pediatrics, everyone says the goal is to bring kids back. And I'm a parent myself. I want to bring kids back. But the question is, how do you do it safely? And I think it keeps going back to this question of the data, which is, do we know, A, are they demonstrably at lower risk? And not just are they demonstrably at lower risk, but what does it do to the community spread issue?
Well, look, the balance of the data suggests that kids are less likely to get infected and less likely to spread the infection. And there's a number of studies that are reliable at this point that demonstrate that. There's other data that you could point to that suggests that kids are just as likely to spread the infection as adults. But I think the balance of the data, and most of the experts agree that kids are less likely to get infected, less likely to get very sick when they do get infected, and less likely to propagate the infection. But that doesn't mean they're impervious. They do get sick. They can spread the infection. There's been one reliable study that shows they're about 50% less likely to get infected, but they can still get infected. And so you still have to be mindful that outbreaks can happen in a school setting. And if you have a very dense epidemic in a city, the school can become a focus of additional spread. And so that's what people are concerned about. But I think the biggest concern is just the health of the children and making sure you don't have an outbreak in the school. Because while the data generally demonstrates that kids do well with this virus, the incidence of severe disease is far less in children under 17 than it is in adults. Children still get sick. The best study that looked at a series of children was in China. It was 2,000 children in China they looked at. This is on the CDC's website, and the CDC points this as the most reliable data analyzing what the experience was in kids. And 5% developed what they call severe disease. Those were kids who required oxygen, became hypoxic. And about 0.6% became critically ill. Now, that is a lot better than what you see in adults. That's a far less significant impact in terms of the total number of kids who became severely ill from COVID. But there were still some kids who became severely ill, and we worry about our children, and so we want to be mindful of what happens in a schoolroom setting. And so schools are going to most schools are going to open this fall. Most schools are going to have physical classes in person. But most schools are going to take measures to try to prevent the likelihood of outbreaks in the schoolroom setting.
Scott, in our communities, kids are really eager to get back to sports. Obviously, we want life to get back to normal to some extent. But reading through the guidelines, at least in New Jersey, that schools are going to be required to, I don't see how you can possibly meet those guidelines and have any sort of these fall sports that we'd be going back to. They're still waiting to make that decision. But what would you say?
I think the sports are going to be a challenge because I don't think that you can create a bubble around the sports like you can in pro sports. So I think you're going to see a lot of schools suspend extracurricular activities because they're going to be focusing resources on getting kids back into the classroom. You're already seeing colleges do that. And schools don't have the same level of resources that a college does, for example. So colleges are going to be testing students back onto campus and implementing routine testing for students on the campus. A lot of public schools looked at doing that. I had conversations with governors about that, and they're having a hard time coming up with the resources for that. You're also going to have a little bit of a challenge with have and have-nots in the school setting, where districts that don't have as much money, have older infrastructure, are going to have a harder time creating the kind of safe opportunities that suburban districts are going to have available to them because they have better resources, newer buildings. So there's an important role, I think, for the federal government here to make sure that there's equitable access to the things that we believe are going to help protect children in this setting. We really don't, there's a lot we don't know. We have to have a little bit more humility about this virus, not just say, well, it's completely safe in kids. We should just send them back for 5 days a week, full days. If schools want to take measures to try to de-densify schools as they toe into this because they're uncertain about what the environment is going to be like, that's prudent. I think we should have a little humility and see how it goes. And that might mean, distance learning 1 day a week and 4 days a week in classroom, depending on the district. It might mean staggering the school day and having a morning and an afternoon session. That should be the discretion of the schools to try to do those things because different schools have different resources and different challenges.
Doctor, you've been more cautious throughout this, but let me ask you, why are you more cautious than, for example, and I don't know if you saw the president tweeted yesterday, and he talked about a number of countries, mostly Scandinavian countries, that have had success bringing kids back to school without flare-ups, or at least without reported flare-ups. Explain your view versus the evidence to the degree you believe that evidence in those countries.
look, it's true that countries successfully did this. Some countries did have challenges. You look what happened in Israel. They had very big outbreaks in their schools. Now, they have an older infrastructure. Their schools are very crowded. That was well known. But if you look at the countries that did this successfully, they all implemented pretty stringent measures. I mean, in some of those countries you mentioned, implemented measures that were more stringent than what I think a lot of public schools here are going to do. So I think some level of thinking about this and allowing local districts to have discretion to take prudent action entering into the fall makes sense. We really don't know what this is going to look like. We don't know what the epidemic's going to look like in the fall. We don't know whether there's going to be outbreaks in the school. So it's the kind of thing you could take a little bit of precaution up front, and if it goes well, then you start to sand away some of the measures you implemented. I think it's far better to do that than to rush everyone back into a classroom, not take any precautions, and have outbreaks, and then you have to close the schools. What I don't want to see happen is schools open up and then have to close because there's very big outbreaks in the schools. And remember, even in flu season, when we have large outbreaks of flu in schools, oftentimes schools will close for a period of time. So you don't want to see that happen with COVID, because then it's going to be difficult to restart things. So we should go into this and do it right and see how it goes.